Hi, everyone. I'm Dr. Samantha, the maternity mentor, and welcome back to another one of our live Q&A sessions that we have here every Monday at 9 p.m. Eastern Standard Time. This is our chance to interact with you guys and answer all of the questions you might have live, as well as answer any of the questions that you have submitted on our videos. Remember, we're on Facebook, Instagram, and Twitter for additional content. So please check us out over there. Also, if you can, please subscribe to the channel and hit the notification button so you can get notified of our latest videos when they come out. We really appreciate all your support. And just remember, if you guys have any questions at all, please feel free to put them into the chat. We're going to go ahead and we're going to get started answering some of the questions that have come in this week on our videos. So our first question was about second trimester bleeding. So she says, I'm 24 weeks pregnant and I had spotting once like now. I was worried if it's normal or something because spotting is more frequent. Please help me. So I love the bleeding questions in general because this is one of the biggest concerns that most moms have. So this gives us a chance to talk about bleeding. Bleeding during pregnancy, generally speaking, is abnormal. The only time we really see bleeding as normal is when you're delivering the baby. During the first trimester, there are some causes of bleeding that are considered normal. For example, implantation bleeding, which is when the fertilized egg attaches to the uterine wall. Also, you can have a period for a couple more months even after becoming pregnant. That can also be normal. You may also see bleeding after sex because the hormones that allow you to sustain a healthy pregnancy also thin the vaginal tissue, making it easier to tear during sex. So these are some of the reasons why bleeding can be normal. However, once you get into the second trimester, a lot of the reasons for normal bleeding go away. And so you want to make sure that you are getting this checked out by your healthcare provider. So a couple of things that you might cause bleeding. You still can have bleeding from sex during the second trimester. This does happen. Another reason for bleeding during the second trimester is a placenta previa. And we have a video on this, but basically a placenta previa, the placenta is the organ that feeds your baby, okay? It attaches the umbilical cord, which attaches to the baby, and it's supposed to attach to the side of the uterine wall. This is uterus, the cervix, right? Your placenta is supposed to be over here. But sometimes it ends up over the cervix. And if the cervix starts to dilate at all, this side of the placenta is full of blood vessels. So if you have any opening, you'll start to bleed. So that's a very serious complication during pregnancy. If you have a complete previa, which is where your placenta is completely covering the cervix, then that's actually a concern and you'll need a C-section, and we monitor you very closely. So this would be one example of why you would want to get this checked out, especially in the second trimester. You can also have a subchorionic hemorrhage, which is a little pooling of blood behind the placenta. That can cause bleeding. That would also want to be checked out. Now, one of the reasons why it's so important, you should always contact your healthcare provider. Listen, you see bleeding, you contact them. You always want to get checked out. But by the time you reach the second trimester, there is a higher probability that your baby, if delivered, could survive outside of your belly. And so we want to make sure we're addressing that very, very quickly. Every hour your baby's in your belly is better than outside, but we definitely want to be able to address any causes that we can prevent. So we go ahead and we want to take a look at that. Now, there is some differences that you should know about bleeding. For starters, the color. So there's pink, red, which is like a bright red, a dark red, and a brown. So pink is usually red blood mixed with some other fluid, like a clear discharge from your vagina, which can be normal. But the pink is not normal because that's actually blood. Bright red. This is our most concerning color for blood. Bright red usually indicates an active bleed that we need to address. Dark red is probably the transition from active bleed to non-active bleed, and brown is usually a sign of old blood. This tells us you were bleeding at one point and the bleeding has stopped. Now, just because you start to see brown and I'm telling you the bleeding has stopped, doesn't mean that you are free and clear and you just don't worry about it. You still want to go ahead and get that checked out by your healthcare provider. You don't want to just ignore that. So it's very important for you to go ahead and address that as soon as you can. But in this case, second trimester, it's very, very important because if you are 24 weeks pregnant, there's a lot of interventions that can be done to assist the baby if you are getting ready to go ahead and give birth. Hi, Jasmine. Welcome. So, any tips for sciatic pain and lightning crotch? So, Jasmine is talking about honestly, a very common and very frustrating condition that a lot of women have during pregnancy. So the sciatic nerve comes down through your back and goes out into your hip and down into your legs. And what happens is the baby's position and the heaviness of that uterus shifts, and it can cause a pinch of the sciatic nerve, which can actually send these lightning sharp pains down your legs. So there's not a lot, unfortunately, that can be done when you are pregnant with sciatic pain. Now, a couple of things you can do. You can look into chiropractic and massage therapy. Now, this is extremely, extremely important. You have to get somebody who is certified in taking care of a pregnant woman with any type of musculoskeletal disease. For example, acupuncture is fantastic for a lot of stuff. And in fact, you can use it for sciatic nerve pain also. But there are certain acupuncture points that if you hit them, you can actually trigger labor. So these are actually very effective treatments. However, you need to have somebody who's got super extra fantastic training in this. Now, other things you can do. So the sciatic nerve goes down one side of your body or the other. Try to lay on the other side. Try not to stand for long periods of time. Warm showers, warm compresses are really good. But here's the thing. When you're pregnant, you can't sit in warm water for a long period of time. That's actually not good. So warm compresses are usually what I recommend. You can also switch to cold. And you just want to take it easy. Swimming can sometimes help also. Now, one of the things that we're used to is we're used to not taking medications when we're pregnant. We get very nervous about taking extra stuff, but there are actually a couple medications that you might be able to use during your pregnancy if the sciatic nerve pain is really bad. We are always avoiding stuff for pain, thinking that the only types of treatments are like those heavy narcotics and stuff, but there's actually a lot of other stuff that can be used. And if you're not sleeping, that can impact your health significantly. So 2 of the medications you could talk to your healthcare provider about, depending on how far along you are in your pregnancy, is gabapentin and Cymbalta. So Cymbalta is an SNRI, serotonin norepinephrine reuptake inhibitor. We oftentimes use it for depression and anxiety, but it can also be used for nerve pain. Gabapentin is a medication that can be used as a mood stabilizer. It's also used in epilepsy, and it can help with sleep and anxiety, but it can also help with nerve pain. So these are 2 medications that are definitely possibilities to use when you're further along into your pregnancy. The nice thing about both of these medications is they are not addictive. They are not controlled substances. So since they're very specific to nerve type of pain, they can be very effective without you having to take a whole bunch. It might just be able to take the edge off. Hey, Gabriella. Any remedies for leg/calf cramps? My feet also curl when they are cramping. So believe it or not, a banana by your bedside in the middle of the night. So most likely your leg calf cramps are being caused by low potassium. Pregnant women are notorious for being low potassium. So, in my line of work, psychiatry, I see a lot of people every day, and I always rule out medical when I'm dealing with mood issues. And I find electrolyte balances are extremely common. So one of the most, believe it or not, common medications I prescribe is drinking 1 Gatorade per day. I usually recommend a sugar-free Gatorade because nobody needs extra sugar. And for all you pregnant mamas, if you're going to do this, do not drink the sugar-filled Gatorade. You want to drink sugar-free because we're trying to avoid diabetes. But Gatorade has a lot of the electrolytes that you need to prevent stuff like this. So leg cramps and calf cramps are often caused by potassium insufficiency. And I actually had these, and I remember eating like potassium, like bananas in the middle of the night a couple times. And it's very common for women to do that. Now, another thing that we're starting to use with moms who have leg cramps is magnesium. So there's a lot of magnesium supplements out there that you can use that are great. One of the things you need to know about magnesium, it's a smooth muscle relaxant. So it helps you relax. That's how it helps the leg cramps. But it can also make you sleepy and it can help treat anxiety. So it's actually really cool to take the magnesium at night before you go to bed, because then this will, help you sleep a little bit better. Magnesium is safe for pregnancy. We actually use it to treat preterm labor in the hospital. One of the things you need to know, if you start to get diarrhea, that means you're taking too much magnesium. You need to skip a day, and then you could try taking a little bit less. I usually recommend the Calm gummies, CALM, not because I I don't own any stock in the company, but actually the Calm gummies, the reason why they're cool is that it's a known brand. So it's easy for you guys to just go into a store and be like, okay, I'm looking for Calm. And then you can take 4 gummies a day. So it's kind of nice also because you can split them up, or you can take all at once, or, any number of combinations. So those are my suggestions for leg cramps. Gatorade is going to be your best friend, in my opinion. It really actually does help a lot. I'm going to go on. Please feel free to keep putting questions into the chat. I have a question that came in on my blood pressure video. It says, I'm currently taking nifedipine 60 milligrams and I feel my heart rate is fast. I took my blood pressure today and it was 130/60. Not sure if I should be concerned. I was on olmesartan before finding out I was pregnant, and that worked great for me. So, a couple of things about this question. So, first thing you need to know is that if you have high blood pressure during pregnancy, it's very important that we treat it. We want to kind of moderate your blood pressure. Normally, for somebody who's not pregnant, we try to get it back below 120/80. However, for a pregnant woman, it depends on how long the blood pressure has been high for. Because if the placenta has gotten used to functioning with a high blood pressure, we can't just drop the blood pressure too low. That'll actually make the placenta function worse, and it could put the baby at jeopardy. So 130/60, though, is a very unique blood pressure. So 130 is the systolic, that's the top number. 60 is the diastolic, that's the bottom number. So normal blood pressure is 120/80. So 130 to 120, it's not that much of a difference, but 60 is really low. So it actually can make you feel a little bit dizzy and other things. We would wish that that was a little higher. Now, do I think the nifedipine 60 is helping your blood pressure? It's hard to say. You can't just take one single blood pressure in time and say it's working or not working, because we need a pattern. It could be that you were that you were like running around too much, you got dehydrated, all this other stuff. It's hard to say what caused this one blood pressure. Now, if you're telling me that all your blood pressures look like this, well, then it's probably not like controlling it. The other thing she mentions is my heart rate was fast. So heart rate being fast is something that you don't want to ignore. You don't want your heart rate to be too fast because it can make you feel out of breath. You might not oxygenate as well, all different types of things. Nifedipine, which is also called Procardia, can raise your heart rate. It's one of the blood pressures that can do this. So, what is fast heart rate? That's a very important thing. You need to be tracking the heart rate for your healthcare provider. So, if your heart rate's over 100, that's tachycardic. That means it's a fast heart rate. Sorry about my cat. So that's a fast heart rate. But if you have like a heart rate that's like less than 60, that's greater than 60, but your normal heart rate is 50 because you're a runner, well, then that's going to be like a heart rate that we're not so worried about. So it really just depends. It depends on what your resting normal is and stuff like that. So you want to make sure that you kind of know that and track it for your healthcare provider. Okay, so we got a question this week on cerclages. So my internal is open at 25 weeks. I think she means her cervix. I received a cervical cerclage at 21 weeks. Is this dangerous? Now my doctor suggests bed rest and progesterone injections. So I think that she might be referring to her internal os versus her external os. So this is the cervix, right? We got a uterus and the cervix is at the bottom. And the cervix has to dilate or open to allow the baby's head to come down. So if this is the uterus, this is the internal os, and this part at the bottom is the external os. And so I think she's saying that her internal part is open already. So a cerclage is a stitch to keep this all closed. So it's a surgical stitch using sterile, thread, and it goes through and it sews this shut and it keeps it closed until delivery. Now, she received it at 21 weeks. Is this dangerous? Honestly, cerclages can happen at any time. Okay. Usually they happen earlier than later. Is it dangerous to have it at 21 weeks versus 15 weeks versus 28 weeks? No, it's not any more dangerous anytime you're doing it. It comes with the risks to having a cerclage. Now, she mentions bed rest and she mentions progesterone. I think she said progesterone injections. Okay. Bed rest makes sense to me. At this point in time, they're trying to keep you pregnant for as long as possible. We have a video on bed rest that we will link into the description. It's very important you ask some questions about what bed rest looks like for you. Bed rest is different for everybody. Some people, bed rest is so strict, you can't even take a shower. Other people, bed rest means that you're supposed to be laying on the couch for, 10 hours a day, but you can go to the grocery store. So believe it or not, you actually need to clarify what bed rest looks like for your doctor. Now, progesterone injections. For those of you who have heard of this before, it was very common for a very long time to use progesterone. One product was called McKenna. The FDA recently came out and they withdrew their temporary approval basically for the use of McKenna during pregnancy. So originally McKenna was approved on like an emergency basis by the FDA for the prevention of preterm labor. They had done some studies that had shown these progesterone medications had actually helped to reduce the risk of having a miscarriage. So the FDA can approve things on an emergency basis if they see enough data to support its use. But once that happens, these companies still have to continue their data collection. So the companies that produce these, like McKenna, kept collecting data. And now what's happened is that they've determined that there is no real benefit versus risk from these things. They just simply don't seem to make a difference. So now they're no longer recommending it. I have seen some providers use progesterone products, and I've seen some that have stopped using it. So really, it's something that you want to talk to your healthcare provider about and ask why they're choosing to use it or not use it. For those of you who are joining us, thank you so much. Please feel free to put your questions into the chat. So I got a question on bottle feeding, which I love. As many of you know, I'm a lactation consultant, but I'm very pro bottles, pro pacifiers, pro formula. I just think that parents should be allowed to feed their baby how they want to feed. So it says, I've always hear that air is a problem with bottle feeding and that it gives babies gas. Yet aren't they sucking in a lot more air at the beginning with the nipple half full of air? So this person is referring to my paced bottle feeding video, and we're going to link the paced bottle feeding video into the chat because it's important for you guys to kind of see what she's talking about. But I am going to explain. So paced bottle feeding is a way to slow down a feeding. It supports breastfeeding very well because if you have a baby who's breastfeeding and struggling with it and we need to supplement, you need to slow down the bottle feeding or they're never going to want to latch to the breast. So the thing with paced bottle feeding is that you start out with a nipple. So the nipple is actually like this. So there's no milk in it at all. And they start out and you put it in the baby's mouth and they're sucking on air. But what people don't realize is they're sucking on air, but a lot of it comes back out of their mouth. Okay. Then when you put it in, okay, it is half full of air and half full of milk. And the baby sucks and you let the baby suck like 8 times. And then you drop it down and they suck on air. And then you put it up and it's half and half. And then like this. And you can see more in the video. So the reason why this works is it slows a baby down. It teaches them actually to listen to their own signals from their body that they are full. I don't know if many of you know this, but formula-fed babies are actually fatter in the beginning, the first 6 months, formula-fed babies are actually fatter after 6 months of age, and breastfed babies are fatter before 6 months of age. The reason for that is breast milk is human milk, and so the baby can digest it better and use it better. So breastfed babies kind of absorb up more nutrients. Now, this doesn't mean formula is evil. It's just formula is a different species milk. It's cow's milk or it's a plant-based milk. So the human being is not necessarily designed to absorb that as well. So this means it's going to take a little bit of time. Now, after 6 months, right, the breastfed baby still continues to absorb a lot of that milk, but they're adding other things in. It just allows the baby to thin out. Whereas formula-fed babies start to chunk up. And the reason for this is that the formula-fed baby has been overfeeding most of that time. When you just let a baby go, go, they will chug down 6 ounces of milk, whatever kind of milk you give them, without even blinking an eye. And then the next thing you know, you've overfilled them. With a paced bottle feeding technique, it gives their body a chance to go, whoa, you're full. And they will tend to eat less milk, but still a normal quantity of milk, basically the same amount a breastfed baby would eat. Breastfed babies tend to eat less ounces than formula-fed babies or babies fed from a bottle. So back to the question. I thought this would cause the baby to have more gas. No. Because believe it or not, most of that milk is just coming out of the side. Most of that air is coming out of the sides of the mouth or not even really sucking into the baby's mouth at all. Now, is there a little tiny bit more? Maybe, but it's not like a huge amount. It's a tiny amount. How do you fix this? You burp them well. Maybe you burp them 3 times during a feeding. Maybe you just burp them a little bit longer. And then you hold them for 10 minutes upright after feeding, but you should do that with a breastfed baby as well. And a breastfed baby who's not latched well on the breast will take in the same amount of air that you see from this type of feeding. So that was a very good question. So I had a question that came in that was about anatomy scans. So it said, I got an anomaly scan at 21 weeks and 4 days. In the report, it said cereb, which I'm assuming means cerebellum, was 18.59 millimeters. Gestational age, 18 weeks, 2 days, less than 1%. 3.7 millimeters. Please reply, is it normal? Why is it lesser? Okay, so cerebellum formation is extremely important. Cerebellum is part of the brain. It's a part of the brain that affects, amongst other things, coordination and muscle control. The reason why we're looking at different structures during an anatomy scan is to see if we need to further monitor your pregnancy or prepare for any type of specialized care once the baby is born. Now, a cerebellum that is smaller than it should be could be a concern. And at 20 weeks, the average range is 16.3 millimeters to 22.1 millimeters. So while that's at 20 weeks. And so while this measurement is in between there, it's still not the measurement for, the 21 weeks. Now, could it be a concern? Absolutely. Are there things that could be causing it? Well, we know that certain infections like COVID-19 and the Zika virus have been shown to affect the brain development of babies. That's why we recommend women who live in tropical areas use like mosquito repellent to avoid Zika. And we recommend that you get the COVID-19 vaccine to avoid a COVID infection. And then, of course, there's other like congenital abnormalities that can occur, like Dandy-Walker syndrome, which is the abnormal development of the cerebellum that can affect a child's motor development and balance when they grow up. So it is very important that you follow up on this. Why is it lesser? It's hard for me to say. There are, like I said, Zika and COVID are a potential possibility. There's also, oh my gosh, I forgot the name of it. Hold on a second. I'm going to tell you what it is. Toxoplasmosis. So the reason why women are not supposed to clean a litter box is that it can contain the bacteria Toxoplasma, and Toxoplasma can cause an infection called toxoplasmosis, which can affect your baby's brain development in pregnancy. So there are some reasons what's going to happen during this pregnancy. Most likely, they're going to send you to a maternal fetal medicine specialist. These are the high-risk doctors that specialize in taking care of women with complications during their pregnancy. So they'll be able to order specialized tests, specialized ultrasounds, and refer you over to specialists to help care for your baby if they do feel like something is going on. So that was a great question. For those of you who are joining us, hi, I'm Dr. Samantha, the maternity mentor. Welcome, welcome. We're here for one of our live Q&A sessions. Please feel free to put any questions that you have into the chat like Jasmine and Gabriella did, and we will answer them live. We're also answering some of the questions you submitted this week onto the videos. So our next question is about antibiotics. I've been prescribed clindamycin inserted vaginally at 29 weeks pregnant for BV. Is it safe? So let's talk about antibiotics. Antibiotics are medications that are used to treat bacterial infections. They cannot treat yeast and fungal, and they cannot treat viruses. So if you're given an antibiotic for one of those things, it's not going to work. Antibiotics kill bacteria. So what happens is you take this medication and it kills off all the bacteria. One of the biggest things is if you decide to take an antibiotic, you need to take all of it. If you only take part of it, you only kill part of the bacteria. Now, you might feel better, but in a couple of days, you're going to get worse again, and then you're going to need stronger antibiotics. In this case, she's talking about an antibiotic being inserted vaginally. So this actually can happen. We're all used to seeing pills or liquids that we swallow for antibiotics, or even IV antibiotics, which is through a vein, right? But you can get antibiotics that are inserted vaginally. She's being given the antibiotic for bacterial vaginosis, which is an infection in the vagina. So that's a very valid way to treat it. And it's actually kind of even better because instead of her taking an oral antibiotic, which is by mouth, that's going to go through her whole body, by being targeted into the vaginal area, they can actually give her less. And the answer to her question, clindamycin is safe for use during pregnancy. So this is a great, great question to have. Hi there. Hi, Michael Jordan. How successful are cervical cerclages? How to determine if it should be used? I don't think I know the success rate for cervical cerclages. I know that they can be very successful. I will tell you in my personal experience in the hospital, I would say most cervical cerclages have been pretty successful. I have seen some of the risks that they talk about, like I talk about in my cerclage video, come to light. For example, I had taken care of a patient. She came in, she was about 14 weeks pregnant, coming in for a cervical cerclage. And we did the cerclage. And after the cerclage, they use anesthesia. So then you have to wait to recover. Usually it's an epidural. So we want to make sure that you're all recovered and you can urinate before you go home. So we were waiting, and during the course of that time, her amniotic fluid ruptured. So that's the sac of fluid that holds the baby. So it ruptured, it broke, which means that she ended up having a miscarriage, unfortunately, at 14 weeks. And there's no way to know for sure if the cerclage contributed, but we do know that having a cerclage can aggravate the uterus, and it can sometimes lead to issues. So how do they determine if it needs to be used? There's a variety of factors, but one of the biggest things is how long the cervix is. So when you talk about a cervix, they talk about it being long, thick, and closed. Okay, so uterus, cervix, long, thick, and closed. Closed is like, I mean, it always has to have some outlet because eventually it's going to open like that. But it closed means it's basically stuck together. Now, if you're getting a cervical cerclage, that means it's starting to open. Okay, it's 1 or 2 centimeters. You're early on. That's what's happening. Now, thick means what happens with your cervix, okay, is that it actually goes like this as you dilate. It thins out and pulls away to allow the baby's head to come out. So thick should be thick early on. If you're 1 to 2 centimeters dilated, you still should have a fair amount of cervix. Now, some women, we're all different, and some women are born genetically with a short cervix. So what that means is instead of having this long cervix, it's shorter, okay? Now, also in preterm labor, remember I just said that the cervix goes like this. So this means at first it shortens, right? So if the cervix is too short, we cannot do a cerclage. Now, for women who have previous history of a incompetent cervix, you're more likely to have that again. So a lot of times they choose to go ahead and just do another cerclage and another cerclage. So that's one of the ways that you could potentially determine that you're going to use one. There's a lot of factors that go into it because, there's risk of infection, there's risk of miscarriage if we do it. There's risk of honestly making the cervix incompetent for future pregnancies. So it's like there's a whole bunch of factors that go into it, and it's a very personalized decision. But I think one of the biggest things is the cervix truly dilating, and how long is it? Okay, so that was a great question. Feel free to keep asking stuff in the chat. So I had a question on my gestational diabetes. Gestational diabetes video. It says, I'm 37 weeks and 2 days having back pain. I'm recently diagnosed with gestational diabetes. Can I deliver my baby normal, or should I go for a C-section because my baby's weight is more than the normal gestational age? Okay, so here's what I'm going to say about this. So gestational diabetes, what happens is your baby gets exposed to tons of sugar. Tons of sugar is going over that placenta into the baby, and the baby gets big, okay? And this is going to create some problems for the baby when the baby's delivered. Very, very, most importantly is that it will probably cause the baby's blood sugar to drop after birth, which often requires the baby to be supplemented with formula or go to the neonatal intensive care unit for IV fluids. So this is one of the biggest complications. The complications for mom is that the baby can get so big she can have trouble delivering vaginally. And Amongst other things, the baby can get a shoulder dystocia. That's where the baby gets stuck in the vaginal canal and the shoulder won't release and the baby has trouble delivering. Now, as far as should I just go for a C-section? There are a lot of risks to a C-section, okay? It is a far riskier birth for a mom than it is to have a vaginal birth, okay? So we don't want to just go into a C-section lightly, okay? This is something that we want to make sure that we are, being very careful about. However, you want to listen to your healthcare provider's advice. If your healthcare provider is telling you that they believe a C-section is the best option for you and your baby, I don't want you to just discount that information, but you need to ask them why. How big do they think the baby is? What are the risks to you? What are the risks to the baby? Also, one of the reasons why I actually have a video on how to interview your healthcare provider, and we can link that into the description. One of the things I tell you to ask a provider before you're even pregnant is, what is your C-section rate? If this doctor is doing 75% C-sections, it's hard to understand for sure whether this is the best thing for you and the baby. If the doctor has a much lower C-section rate, then it's probably a good idea. Ultimately, C-sections are not terrible births, okay? They are not fake births. They are just as real of a birth as a vaginal birth. One of the things that I hate is that women who have a C-section are somehow shamed for not having a natural birth. And I'm going to tell you, it is way harder to deliver a baby by a C-section, in my opinion, than it is naturally. You're going to have more pain. You have a surgical incision. There's a lot more logistics to it. And shaming women for having a C-section is terrible. It's not to say that women who have vaginal deliveries don't have rough times. They do. But C-sections are a big deal, and those women definitely give birth. And at the same time, though, they're not evil. If they're needed, they're wonderful. And there's so many wonderful moments you can have in a C-section, okay? So I think that this is something that you really need to talk to your healthcare provider about. But if your baby is measuring 9-10 pounds at 37 weeks and they're telling you C-section, I would just get a C-section for sure. And just so you guys know, the other thing, at 37 weeks, if she's not in labor and she decides to get a C-section because of, like, say, the weight of the baby, it's going to be planned. So you get to know the date, you get to know the time. Everybody in the hospital knows you're coming. They're planning an OR for you. They're planning the staff for you. Like, everything gets lined up. Planned C-sections are brilliant because everything is already planned. So there is some advantages to that if you're having one. Tammy. So can you start progesterone early in my pregnancy while waiting for the cerclage? I'm sorry, you had 2 second trimester losses. That's hard. That's really, really hard. Okay, so I was talking about it just a little while ago. So progesterone, you can start early in your pregnancy, but the data doesn't support that it helps anymore. So up until literally it was like a month or two ago, progesterone was the standard for helping prevent miscarriage. And now it is no longer really an option. It's not bad. It's just the data has shown that it doesn't help at all. So the FDA has pulled their recommendation to use it, basically. They had given emergency recommendations for the use of progesterone, and they took that away recently because there's just no data to support its use. Now, I can tell you some healthcare providers are still using it and some aren't. So I'm going to tell you, you should, if your healthcare provider is recommending it, talk to them, see what they're saying, ask them about the FDA stuff. I don't think it's bad. I just don't know that it's going to help. One of the things you may want to ask about also, Tammy, is an abdominal cerclage. So they're a lot more rare, but abdominal cerclages sometimes are a little bit more effective. So depending on why you had your 2 second trimester losses, if it was about an incompetent cervix, you may want to find out if an abdominal cerclage would work better for you. The abdominal cerclage is attached to the abdominal wall, and they're kind of like, they're like a heavy duty cerclage, but there is one significant issue with them. If you have an abdominal cerclage, you are guaranteeing yourself a C-section. You will never have a vaginal birth. It is not, it's contraindicated for an abdominal cerclage. So this is not a decision that you need to like really talk to your healthcare provider. And that's if they do one, because not every provider will do that. What I would tell you is to talk to your healthcare provider and find out, should you be having like a modified activity level? Should you be having sex and all that other stuff, to see what's going on, because second trimester losses are hard, because usually at second trimester, we're talking about an incompetent cervix. Also, I would hope they're going to do your cerclage at like 12, 13 weeks. That's oftentimes when we see it done. We had a couple questions on the RH factor video, so I'm going to do those. Can I receive the RhoGAM injection immediately after birth? Is it necessary if I receive it at 28 weeks in my first pregnancy? I think she's saying she got it at 28 weeks during her first pregnancy, and she's now on her second pregnancy. That's what I'm going to go with. Okay, so RhoGAM. So RhoGAM is a product to help treat RH incompatibility. So what am I talking about? We're talking about blood type. So there's 4 different types of blood: O, A, B, and AB. And then after that, there's a positive or a negative. The positive or negative is the RH factor. Now, if you're an RH negative woman and you get pregnant with an RH positive baby, well, our blood and our baby's blood circulate together, and your body looks at that RH positive blood and it looks at it like a foreign invader, and it starts to develop antibodies against it. And those antibodies can attack the baby and can actually cause a miscarriage or stillbirth. So we've come up with a medication that helps prevent that reaction, and it's called RhoGAM. So we now give RhoGAM at 28 weeks pregnant and then again after birth. You should receive RhoGAM if you are a pregnant woman with a negative blood type after every miscarriage, every abortion, and after the delivery of every baby that you have that is RH positive. And again, you can have an RH positive baby because your partner could be RH positive. Now, when your baby is born, they're going to test the baby's blood. If the baby has RH negative blood and your blood is RH negative, of course, then you don't need RhoGAM. That's the one time you don't need it. So if you received it during your first pregnancy, you have to still receive it in your second and your third and your 10th. You receive it every single time you are pregnant. Now, the other question we had is, I had an abortion a long time ago, and it's unknown if I am an O. It's unknown if she got it. She's O negative, and she's finding it difficult to conceive. So this is an interesting question. So what she's telling us is she had an abortion a long time ago, and she doesn't know if she got RhoGAM, and now she's having a whole bunch of trouble getting pregnant. It is possible, if she's getting pregnant with a RH positive baby, that her body is looking at that as a foreign invader and is attacking the baby. So unfortunately, what is going to happen is some complications, and it can cause miscarriage. What you need to do is you need to go to a fertility specialist and talk to them. Usually fertility specialists are very good at looking at this, or maternal fetal medicine. And you're going to want to ask them what you can do. They may be able to give you RhoGAM proactively before getting pregnant to see if that helps calm that reaction down. So that's a very important thing. For those of you who have joined us, please feel free to put any of your questions into the chat, okay? So we got a question about yeast infections. My OBGYN prescribed oral fluconazole single dose for me, and now I'm worried because I'm in my first trimester. So fluconazole, this is a very controversial medication. Fluconazole is a very effective medication for yeast infections. It's very commonly used. But if you look up online about the research, it is actually known to cause birth defects. And yet, I have seen it used in pregnancy. This OBGYN clearly gave it during pregnancy, and tons of women get it during pregnancy. So what's the deal? The deal has to do with the dose. So oral fluconazole has been shown to cause birth defects at high doses. And at low doses, it is safe and effective for the treatment of yeast infections. Now, it is a risk versus benefits thing. So you might be saying, well, it's just there's no, there's no benefit worth this risk. Well, yeast infections are one cause of miscarriage. So you need to treat a yeast infection quickly and effectively, or this could actually lead to you losing the baby. So this is why we do consider fluconazole as a treatment during pregnancy at low doses, because if we can knock that yeast infection out fast, it's going to be better for you and the baby. So this is an example of why we need to take care, like look at everything about it. So, for this person, if you're listening, it does depend on the dose, but it's one of those things that it's probably okay. We got a question about bed rest. I'm 6 weeks pregnant right now, and I've been spotting all week. I've been struggling to get a hold of a doctor, and referrals are taking a month. I went to the ER today and was put on bed rest for tomorrow and the rest of the weekend. So scared. I do, however, notice an improvement in my spotting when I am resting. During the night and morning, I don't spot, only at work or when I'm out and getting things done. Very scary, but hopeful this will help soon. I'm hoping I can get a hold of a doctor. So this highlights how bed rest can work. One of the things that you guys need to understand is that bed rest does come with risks. It puts you at risk for blood clots and it puts you at risk for pneumonia. So you want to use it carefully, but sometimes what's going on with your spotting is that you are going too hard. You are like working yourself ragged and it's just too much for your body. So you want to make sure that you're taking it easy. This is a very big mistake women make. They just go, 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 go. And the next thing you know, they're dehydrated and they haven't eaten and they're getting urinary tract infection because they're not peeing enough and this kind of thing. If you're put on bed rest, it's extremely important that you understand what bed rest looks like. And I actually like what this person says. She says that when she's resting in the morning or the evening, her bleeding's better, but during the day when she goes to work, it's not. That's because her bed rest allowed for her to go to work. Some bed rests will allow you to go to work. So it's very important that you understand what your healthcare provider is asking you to do. But it is a very scary thing to have bleeding, and I'm glad you were, listening to that, that doctor. So I got a question about miscarriages. My daughter-in-law had 5 to 6 miscarriages, 2 in a row. Then a son was born. Then she had a girl, ages 7 and 4, and then 4 more miscarriages in a row shortly after hearing the heartbeats. This last one just happened on the 15th of September, 2023. When her mother was pregnant with my daughter-in-law, she was on birth control for about 4 months before she was told that she was pregnant. Could this be the reason she has more male hormones than female? The doctor at the OBGYN had her on a hormonal pill, but instead of telling her to stop taking the pills after they heard the heartbeats on the last 2 pregnancies, she was told to take the last pill and then stop. Could this be the reason for the last 2? So this question is complicated and it's very hard to say for sure. If the hormonal pills are some form of birth control pills, birth control does not increase your risk of miscarriage, according to a couple studies that were done. Okay, usually we do tell you to stop them as soon as you find out you're pregnant, but they're usually fine. Progesterone, as we just heard, progesterone is not recommended during pregnancy anymore because we don't see any risk or benefit. It just doesn't seem to do anything, but it shouldn't cause miscarriage. And then if there's other hormonal treatment that was given, it's hard to say without knowing what those hormones are. Being pregnant and taking hormones shouldn't affect a person's hormonal levels as an adult. That's not really how it works. It's much more likely that there's a comorbid condition going on, like PCOS. So PCOS is polycystic ovarian syndrome. And one of the things that happens with PCOS is insulin resistance, but there's also increased testosterone in a woman usually. And PCOS can make it hard to get pregnant and stay pregnant. So if she has undiagnosed PCOS, for example, it's very likely nothing to do with anything that happened with her mom, and it is more likely to do with possibly her dietary factors or her weight going into this. And, that might have caused her to receive some hormonal treatment. So hard to say, but I don't think it was caused by the mom being on birth control. We're getting close to the end. I have one more question. So if any of you guys have any questions, please put them into the chat. Our last question came to us. It says, I'm feeling weak with dizziness. I saw my period last month, and I don't know if I am pregnant. So if you are not sure if you are pregnant, you should take a pregnancy test. It's very important that you know if you're pregnant because there's a lot of things that you should change about your life if you are pregnant. For example, you don't want to be drinking, you don't want to be smoking, you want to be making sure you're drinking lots of water, stuff like that. So if you think you're pregnant, it's important to know that. So you want to take a pregnancy test right away. Now, this person said she's dizzy. Okay, whether you are pregnant or not, if you are experiencing dizziness, you don't feel good, you need to contact your healthcare provider. We are in the day and age of a whole bunch of viruses coming back. Okay, RSV is coming back. The flu is coming back. We've got COVID-19. We've got strep throat hitting people at alarming rates. All of these illnesses can make you feel sick, and pregnant women are immunocompromised. This means that you are absolutely at a higher risk of, getting more sick than the average person. So if you don't feel good, you want to make sure you get it checked out. Cheryl, you are so welcome. Thank you for putting your question onto the video. So just for any of you guys who are joining live, Cheryl asked her question on one of our videos in a comment, and this is like where we try to answer those. So, thank you for doing that. So, I think that is really the end of tonight, unless any of you guys have any questions for me. I'm going to go ahead and tell you, my name is Dr. Samantha. I am the maternity mentor. I am here every Monday at 9 p.m. Eastern Standard Time, answering your questions from the videos, as well as your live questions like the ones we got from Tammy and Gabriella and Michael and Jasmine. So I appreciate all of you guys. We are also on Facebook, Instagram, and Twitter for additional content. And I want you to share the channel with your friends and family. Remember, you can answer your questions live, or you can put questions on our videos like Cheryl did, and you can get the answer live here. Please, please, please subscribe to the channel. It really helps us out, and we really, really appreciate it. If you hit the notification button, you can get notified when our latest videos come out. And we really appreciate everything. So my name is Dr. Samantha. I am the maternity mentor. I really appreciate all of you. I will see you here again next Monday at 9 p.m. Eastern Standard Time. Bye for now.